Very good morning to one and all present here. I welcome you all back to the second day of Rise for Healthy Aging Longevity India conference. I hope you are all excited for the upcoming lineups. So, without further delay, let's begin the first session for today, Future of Health. And I would like to invite the session chair, Professor Ramrai Bhatt, Department of Developmental Biology and Genetics, IISc. Over to you, sir.
Thank you. Welcome and good morning, everybody. Um, so I'll be the chair for the first session, and the session begins with a very special fireside chat between two very special individuals. Um, of course, with my gray beard, cannot be claimed to say that I'm fanboying, but maybe I'm fan manning at the moment to be able to introduce these two individuals. And they are Mr. Prashanth Prakash, Padma Shri awardee, Partner of Accel India, pioneer of the Indian venture capital ecosystem, has backed transformative startups including Flipkart, Ola, Swiggy, and has, of course, catalyzed this very initiative which has brought everybody here on the stage. Mr. Prashant, come on to the table. While Prashant makes his way here, I'll introduce the second special individual, and that is, of course, Nithin Kamath. Nithin is the founder and CEO of Zerodha, India's largest brokerage firm. He's empowered millions, or perhaps billions, of investors. He has revolutionized India's stockbroking industry with his innovative discount broking model and technology-driven approach. It's a deep pleasure, Nithin. Please, if I could invite you onto the stage.
So I just want to also, Nithin just a few days ago got the Entrepreneur of the Year award for globally.
No, thanks for that.
So Nithin is generally, unlike his other brother, who is famous for talking a lot online. Nithin is very tough to get him to come and speak. So Nithin, I hope today you're comfortable doing what you're doing.
I'm comfortable, especially since I don't know if everyone's aware, but since I had the stroke last year January, I've not been I'm not been getting out that much, and yeah, I'm slowly trying to seep back in. So let's I know hope I can share some interesting things. So.
Yes, look forward to. So I think the topic today was medicine 4.0, and it's interesting that medicine 3.0 really didn't happen, and people are starting to talk about 4.0. So that's what sometimes industry wants new terminology and new things to just keep things kind of fresh and going. But I think it is really I think there's 2-3 big anchors of medicine 4.0, and we'll kind of touch upon a lot of them, Nithin. But I wanted to start out by just prefacing the conversation by saying there was always a need for personalized care, right? And patient-centric care, and all of that was what 3.0 was talking about, where your physician would spend time with you, really get to understand you, and all interventions are more personalized and so on. I think where maybe 3.0 really did not take off is while technology had a lot of promise, I think a lot of that did not actually manifest. So the scalability became an issue. So 3.0 remained at some level, just pockets of conscious medicine, and it really didn't get into mainstream. But I think today with AI, looks like one of the fields that everybody is really excited about, how it can actually get things to market and get things to scale. Of all the things, healthcare and specifically Medicine 4.0 seems to be what everybody is very excited about. Uh, Looking at where we are today in a country like India, uh, I mean, you've just been through a medical situation, and what was your experience with the medical system? And I know that you had the option of accessing global healthcare and a little bit in Singapore and other places. So, what was your experience in uh, just the interactions with the medical system, and did you get that personalized care, and how did you actually see this current model?
Yeah. I mean, we basically had two episodes. One was Seema's cancer. My wife went through cancer 3 years back, and then it was my brain stroke, which was last year. With Seema's cancer, the first thing we realized when we walked into to meet the doctor was they were all trying to make it like a secret, as in they didn't want you to. I mean, they were trying to. I mean, the first thing when we went to the doctor, the doctor said, uh, we have like this private thing where no one will get to know, and it was very surprising. Um, why would people want to keep it a
Why
secret?
is the secrecy the big deal here?
Yeah, as in it's quite it was quite startling. That's how by the end of it, Seema wrote a blog about her whole experience, and the blog became quite popular. And a lot of people have been reaching out to her, saying, uh, you know, you actually shared your experiences. Thank you. With me, it was. um a lot of people make it about Nithin was going through stress and etc. It wasn't that. I basically, I'm probably one of the least stressful entrepreneurs out there. Uh, um, the one thing I could have done probably better is I do everything beyond below the neck. I I I check up once in 3 months. But above the neck is something I totally forgotten about, and um, that's when it basically most of us are constantly always bothered about what is below the neck and testing it and etc. And yeah, so the way the episode happened was my dad had passed away in December. There was just no sleep. I probably contracted COVID during that time, and we had gone to my dad's hometown, and so there was a lot of dehydration. So so one of these things affected uh, you know momentarily. It was more like an accident. Uh, so yeah, so after that, after say 6 months, now every 3 to 6 months, I go to like above the body also above the neck. Like we were in Singapore recently, and the reason I went there was to do an MRI once a year, just to see if you're everything is okay in the brain. Uh, uh, so yeah, but coming back to um, your question, what is different from here to there? I think even though I have access to now that have access to the best, you don't get personalized attention, right? As in when you go meet a doctor, doctor has I don't know 25 appointments in a day, and he has to make some time for you. Um, when I go to say Singapore, he has taken out half an hour, 45 minutes, and I'm wondering, when will he ask me to leave? So it's more that it's. I don't know what's the solution for this, because we got so much population in this country that um, I don't know. I don't know how do you solve for this problem.
So you, the advanced diagnostics that you said you went through, I think there's a lot of role AI and technology is playing, Nitin, where I don't know if you've heard of this new company called Neko. How many of you have heard about Neko? Yeah, quite a few here. So where these sensor technologies, I think they collect 1 million points of data from about 70 sensors in 30 minutes. And they claim to use a lot of AI on top of that to be a lot more preventive and predictive on what they're doing. So there are now modalities where, unlike MRI, which is a lot, I mean, people don't want to go through an MRI every 3 months or every 6 months, right? So I think there is in medicine 4.0, while wearables will continue to evolve, but I think these other sensing modalities which are less intrusive, uh, I think you'll see a lot more advancement in that. What's your view on? I mean, is that something? So you would be more comfortable doing that compared to doing an MRI?
Yeah, I mean, now that you are there here, so we, the problem is in India is you don't have access to all of this. Like just the fact that there's a longevity conference happening here is special. So it's kudos to all of you, who are making this happen.
Yeah, so, and I think some of these technologies need to be, I think what we have been good at in India is once, I mean, these technologies get kind of globally, the IP gets created, I think repurposing it for the Indian population and making it work, like in the smartphone, I think that's a very doable endeavor. And I think there are enough entrepreneurs who are looking at that. So some variation of NECO in about 12 to 18 months in India, I think is a I mean, could be a reality, right? So, and that could change a lot in terms of early detection.
So I got more questions than answers. So so let me ask you a question.
Sure.
So, like, so what's a? I mean, how can this scale? Like something like Nico as in.
Yeah, see, I think if you look at a typical cost of one of these devices, as far as you can get that cost, I mean, an MRI is multiple crores, and the infrastructure that is required to house the MRI, so you're talking about $2 to $3 million just to get an MRI set up and fund the initial, the volumes that you need to make it work and so on. But I'm thinking of new modalities which will be more in the 200K USD type of range, which will at least bring it to the middle class affordability level. And the broader India is a different issue, but
But would it be as good as an MRI? As in.
no, it won't, right? So you will have to do a combination of some type of CT. So I think the cost of CTs, there are variations of CTs that have. So the typical medicine 4.0 today, advanced diagnostics is an advanced MRI plus a CT plus your genetics and your metabolites and maybe your gut. So this is the entire range, and that is expensive. So, but you might not need all of it. So, can you have a more affordable variation of this? And I think that is what AI can also provide, right? So, what kind of data is actually relevant, and are you able to kind of modulate some of the sensory stuff that you're collecting data on to be sufficient to be able to catch these early signs. So today, I think we are taking a little bit of a sledgehammer approach and trying to do the whole 9 yards. But I think that's hopefully going to get refined. And in this advanced diagnostics, you'll get to a point where it's kind of will. So what do you think is an affordable price point in India for advanced diagnostics for it to be kind of more mass? I mean, today a corporate health check is about 5K, right?
And that.
So would 10K, would 10,000 rupees be a decent?
I mean, the problem with diagnostics is people don't wake up until accident happens, right? As in, I mean, while we're all in the room.
See that, at least my view is that awareness is changing. You've seen companies like Nora, right? So which have in their own way tried to change some of the early diagnostics kind of stuff that they're doing. So I think that I see as maybe version 0 of what could be advanced diagnostics. So I would say in the next 2 to 3 years, you'll see a lot of Nora plus plus and multiple new variations of that. And that's not a lot. I mean, it's not really that expensive. And if you see the number of people, I think there's a lot of word of mouth in some of this. So if I go there, I see some early detection, I talk to 10 people about it, right? So I think awareness, do you think, is a big thing about people wanting to do this? Or affordability is one,
Yeah.
the awareness is the other.
No, I mean, the awareness is a much bigger problem, because if people are aware, then affordability, at least the top 5% of the country can afford these. But yeah, creating awareness for this is
Yeah, and the whole idea of medicine 4.0 is, can you detect and predict so that you actually end up spending less money, right? So I think that awareness is also, and here I believe that there are people, you want to have more anecdotal stories where people have gone early, have seen these early detections actually happen in their lives. And so there's, now technology where they're saying that by looking at certain pathways, you can predict whether you're 2, 3 years away from early diabetes, right? So I think what's important is to be able to wake up people, in my opinion. So you need to be actionable. You just can't go to the same 4.0 concierge and the person tells you eat well, sleep well, do this, do that, right? So you have to be able to give them a level of actionable information that they have not seen before. I think that requires science, that requires AI and some tech. Unless we build that underlying stuff, which is what I think this year is going to be about globally.
yeah. I mean, whenever I can, I use my social media handles to promote the
I've
idea.
seen that. I think good. Thank you. I mean, I think you've been doing a lot in terms of being advocating some of this. So I'm just switching gears a little bit, Nithin. I know you're a very avid uh, fitness person, and I always have this question that why is this always like two extremes? You have people who don't do anything, and then we have people like you, Nithin, who train for marathons and you're training for high rocks now, and all these other really extreme sports. And in India, somehow we have, seems like as a generation, I mean, even in this new generation, the Gen Zs, I see the majority of them still not taking strength training, still taking a lot of this overall fitness that seriously.
Yeah, I mean, this is the big problem. I think more than strength, I think first comes nutrition, right? As in, essentially, what you put into your body is the first aspect. I mean, medicine 3.0, this is sleep, and then comes all your fitness activities. Uh, uh, yeah, I
And
mean,
there, where do you think, I mean, the whole nutrition, we have lost the plot on nutrition in the country. Once we have got affordability and this disposable income, the first thing we seem to want to spend is on food, right? And the wrong kind of food. And really not pay that extra for food that is clean and takes cost to grow. So
I mean, see, the thing is about food is as long as you're ordering it from somewhere, it's questionable, right? The quality of it is questionable, and the fact that as a country we've made it so easy to order on the phone, just probably goes to
it's the companies we have funded that are to blame.
uh, but um, yeah, so maybe maybe the companies are to blame, but companies will put in what sells them the most. So as and when uh, people demand for healthier stuff, companies will put healthier stuff. It's just that the awareness in the people is so little about eating healthy, and eating healthy is not too complex of sorts. As in, I mean, uh, I I have trouble counting calories and all, as in I can't. I typically just make sure that I'm having some protein, some carbs, some fat in every meal. Uh, but I think most of the people lose the concept of proteins and etc. Because South India, especially, is we are more carb dense in terms of our meals. So yeah, so it's a it's a problem. So and I think awareness is one thing that can hopefully solve it.
Yeah, I think with Ramray, Longevity India, I think one of the real anchors is this our ability to, uh, uh, you know, demystify some of this. While we can do it through our podcast, but I think at a broader level, at a population scale, how do we get some of this information out? Nutrition, I think, is a big one because I think that's top of the pyramid, right? I mean, what about in fitness? I think as a country, I think we got to cardio very quickly, right? So there's a lot of awareness in the country on cardio, but strength training somehow never. The only people in strength training are people who go for these extreme things like what you did, Nithin. Is there a uh, um, mindset thing in India that muscle is not that important, or the awareness on the importance of muscle is still something in our culture is very low?
Yeah, absolutely. As in, I mean, I guess all of the people here in this room would know it, but the fact that uh, your strength keeps dropping, as in more than uh, fitness, it's about how do you maintain strength over longer periods of time. Like, can you dead hang for a couple of minutes? Can you farmers carry your body weight for so much distance?
Nithin, that is really, very high. I'm talking about people being able to do very basic strength training, right? I don't think people are there. So to be able to farmers carry your body weight, how many in this room can farmers carry your body weight? Yeah, okay, not bad. So a few people here, yeah. But at a broad level, I think that awareness on that is also a big issue.
Yeah, I mean,
And what is the entrepreneurial opportunities here? You think in terms of food?
I
And
mean, we are funding like a bunch. This is as Rain Matter. We run.
this is as part of Rain Matter. So Nitin has just funded a bunch of companies in India that are elevating the quality of food that is being produced in the country.
Yeah, not just food. It's more around health. So uh, So yeah, so
And biopic is one of your.
so uh, in sorry,
No, no. I mean, just as an entrepreneur opportunity, you always believe that getting clean food is been a big issue in the country, and there's hopefully going to be awareness over time, and this is a great opportunity
yeah.
for entrepreneurs.
Yeah, I mean, in terms of food, the thing is, I always question when the food is put in front of my in front of my table, what's the source of the food? Like, so the anyone solving for that, I think there's an opportunity in the market. We have funded like Akshay Kalpa, Two Brothers, and etc. So who are who make sure the quality of food is X. Um, in terms of um, yeah, I think there's a lot of opportunity there.
So the other topic is there's a lot of coaches, right, in the country. There's a fitness coach, there's a nutrition coach, but we have lost this person who is kind of your personal physician and your care coordinator, so to speak. And I don't think in our medical system, in our lifetime, anybody is going to uh, change the medical curriculum in any way to be able to bring back this kind of one point of holistic care individual, right? So how do you get some of this back in as talent into the system? Do you have to have a new so some new talent creation initiatives that creates this new kind of care coordination for this conscious medicine or medicine 4.0, where a clinically competent care coordinator who understands nutrition, understands enough of clinical sciences, enough of exercise, and I mean, so you don't need these four coaches to, and which rich people can afford, of course. But if I'm a common person, do we need this one individual who can be your companion, clinical companion, and a little bit blended, hybrid, a little bit of AI plus human? Do you think that in the next 1 to 2 years, is that something that you would like to, as an initiative, support, fund?
No, absolutely. I mean, uh, we funded Fitto. I see Marcus here. So if we funded Marcus, so yeah, so I think we are hoping that the ecosystem, we somehow fund this ecosystem that can generate the next bunch of physicians and coaches and etc. So I mean, I think there's a huge opportunity there as well.
Yeah, so let me just open it up for a few questions. So we'll have enough time for maybe 2 to 3 questions. Yeah, a question here. Yeah.
Thank you for that chat. I'm Dr. Devi from Singapore. I recently came across that podcast where Brian Johnson had an opportunity, and I've also attended a session where Brian Johnson was speaking and he's talking about supplements and his rate plasma exchanges and everything. On the topic of medicine 4.0, where we're living in India, the AQI is actually questionable. We can deal with additional protein in our body, which also now there are so many news reports where some of the protein that's out there is also fake, right? So when we're dealing with so many challenges in India, especially even with the AQI, isn't that a fundamental issue? Because you can strength train, you can eat clean, but if the air we breathe is so unhealthy, then how do we address that? And if it's very, very difficult to address that, so what have you bias perhaps?
Yeah, I got the question. So I speak to, and the way I've tried to understand this is I keep speaking to people in Delhi, right? How do they actually deal with this? So I think they've figured out that how to get their, at least their home environment at home and sleep those periods of time you get to a reasonable AQI, and your AQI is okay in the car, in many of the vehicles that you travel, and then you have to deal with a little bit of the AQI during the other time. So there's no, I think some of this you try to use technology and whatever lifestyle adaptations to be able to make the best of what you have. But there's so many other things. So just because AQI is a problem, I would not de-emphasize any of the others because they all add up to a lot. So I would rather get the 80% and I'm missing out 20-30% of value because I'm breathing not so great air. It's still okay.
Yeah, I mean, just to add to
Yeah, please.
Prashant's point, if you can, stay away from the crowds, so stay away from. I mean, I stay like the other side of town where AQI is just like 40, so it's a choice you have to make, and hopefully enough people start making this choice. There'll be some changes.
Thank you, sir. Within, I'm a cancer surgeon, and I just wanted to make a point on screening. The biggest problem we see with screening today to make it as a generalized mass population employees is we will lead to unnecessary procedures and unnecessary expenditures, and there is something called lead tag bias in statistics. That means you end up picking up more diseases that you would never be actually having a problem with in your life. And this would be perfect for capital medicine. You look at our hospitals, we'll be most happy to go on screening the entire world and the EBITDA will increase. The overall thing is, this is going to have a flip side to it because I deal on a daily basis with patients come to me saying, please remove my thyroid. I have a cyst over here and this particular thing could become malignant 25 years from now. Which are all unethical surgeries which are currently increasing. And I'm saying US, I was just reading the report, had a massive surge because of what we call
Yeah, understood. So you need to be careful about a lot of advanced screening.
increased diagnostic scrutiny will be a bane and not a boon, is what I want to say.
Sure, good point. Maybe, okay. Two last questions. Okay, right here. Oh, okay, very quickly, yeah.
Actually, like whatever, I mean, it does actually have an impact. How do you see like government developing reforms on emulsifiers and more things which is causing endocrine disruptors? Well, US is going through it. Have gone through 60 plus genders and it's going absurd. People are losing, yeah, the endocrine system, the hormone mutation is become a thing. It's not an actual.
I don't think he's an expert in that. He won't be able
I
to
mean,
comment on
yeah,
that.
it's.
Sorry. Yeah.
Discussion. Thank you, guys. So I love the idea of that companion, going back to that model, the clinical companion with maybe agents, AI agents,
Yes.
the human in the
Like
loop. How do you even think of scaling that?
Yeah, see, the reason you can scale it is because of the AI companion technology being a little bit uh, of that component that can provide guardrails and can also accelerate the learning curve of a person who is in who's in this journey. So and I just recently, I'm just giving a very different example, but a school in Africa just used LLMs after school for 2 hours a day for their students, and they increase their learning. They increase the learning capabilities equivalent to 2 full years of coaching in school. So I think there is a value in the normal world. This what I call as human in the loop AI technologies, I think will be a lot more useful and disruptive in the immediate future than AI only.
On
Maybe this one last, I'm sorry, I disrupted this question.
just keep the question brief. So,
Yeah, this last.
Just one question, but Mr. Kamath, so we have trained 12 dentistry doctors. They are solving psoriasis, they are solving anatoidation, but just following the lifestyle thing. So I think
No, understood. I think we need to pick up people from all backgrounds and be able to. But I was telling Nithin that we need a new, a very new type of institution that can train these next generation of AI, AI plus this human type of models, right? So it's a big entrepreneurial opportunity. So sorry, I think I really thank all of you for being so engaged and look forward to interacting with you outside. Thank you.
thank you so much, Mr. Prashanth. Thank you so much, Nithin.
Thank you, Nithin.
Thank you.